Welcome to Marian Ayurveda. In this episode, we're going to discuss a condition that causes a lot of distress for women, which is leucorrhoea or white discharge. I am Dr. Anumod Kakkassery from Marian Ayurveda, Thrissur. White discharge is a major issue that many struggle with, often failing to find relief or understand the underlying cause despite various treatments. It can present itself in many different ways. It varies significantly from one woman to another. While some experience a very thick discharge, others might have one that is watery, just like water. For some, it may be accompanied by a foul odor. Others might notice it looks like a thin film. So it manifests in several different forms. Therefore, treatment can only be successful if we address the specific underlying cause. We cannot cure the condition by giving the same medicine for every type of white discharge. So first, let's take a moment to consider the cause of a very thick white discharge, which might in some cases look a bit like curd or something similarly dense in texture. To some extent, this type of white discharge is caused by bacterial or yeast infections. But when we look at why this only happens to certain individuals, what we find during treatment is that it's often due to digestive issues. Now, for those suffering from this, you can consider the link between the food you eat and your white discharge as I explain this. Suppose a person eats biryani one day. If they experience a very thick white discharge the following day, we can understand that this person has poor digestion. That is, when the body fails to digest the biryani, immunity and resistance drop suddenly, causing infections to increase, which leads to thick white discharge. The same thing happens after eating beef, nuts, or even an oil-fried puri. The white discharge increases the next day. So we can conclude that for such people, digestive problems are the primary issue. On the other hand, another person might eat a laddu or a jalebi one day. If they say their white discharge increased the next day, we can understand that a pinworm infection is the dominant factor for them. As I've mentioned before when discussing parasites, they primarily reside in three areas of the human body. One is the anus, as we all know, the second is the appendix, and the third is the vagina. We know that parasites can easily travel from the anus to the vagina during the night and establish colonies there. These parasites become very active when sugar is consumed, gaining strength and causing an infection, which results in white discharge. So the second cause we are discussing is white discharge caused by parasites. Similarly, a third type of white discharge happens after we eat certain foods one day, like eating spicy and sour bird's eye chilies or consuming very spicy food. If you notice an increase in white discharge the next day, understand it's an allergic type of discharge occurring. We know that just eating spicy food can cause a runny nose or sneezing. Similarly, the vagina is an area where such reactions can occur. If we eat too much spice, or for people with allergies, those who sneeze from dust or get skin rashes, especially women, if they consume too much spice, sourness, or salt, they might experience a watery allergic discharge the next day. Similarly, as we all know, an infection, whether it's a yeast or bacterial infection, can cause bacterial growth accompanied by a foul smell. If an infection develops as a result, two things will be noticeable in that vaginal discharge. First, there will be a foul smell, and second, the white color of the vaginal discharge will change to a yellowish or greenish hue. If there's a foul smell and a change in color like this, we can understand that a bacterial colony is present there. In such cases, just paying attention to your diet isn't enough. Once an infection is present, we will certainly need to proceed with various treatments. Where there's an infection, our lady doctors at Marian Ayurveda typically use procedures like a douche to eliminate bacterial or yeast infections. Medicine alone isn't enough. Through treatment methods like a vaginal douche for cleaning, the vagina is cleared of the infection. After that, medicines to prevent bacterial infection are applied to the area. By also taking internal medicines to prevent infection, we can manage white discharge that has a foul smell or a change in color. Now, if you are unable to see a doctor, one home remedy that I can suggest is to take neem leaves or curry leaves, making sure to wash them thoroughly, then grind them into a smooth paste. You can use this paste to gently wash the vaginal area, or you can wrap the paste in a clean cloth and place it inside for a short while. This may help to some extent, but please remember it is not a replacement for professional medical care. If the issue is caused by worms, a vaginal douche is also effective in that case. For worm-related issues, a vaginal douche with Ayurvedic anthelmintic medicines and a pichu, which is a medicated oil, can be used. By placing cotton soaked in worm-killing oil inside, we can prevent pinworm infections. Even for those with an allergic response, such as a watery white discharge, there are various medicines available to eliminate the allergy. These can also be applied internally by using these in the form of oils or ghee on cotton and placing it inside, or by taking allergy-reducing medicines internally, the condition can be treated. Similarly, if indigestion is the issue, vaginal douching is indeed very important. Likewise, by taking internal medicines that improve liver functions or metabolic activity, we address this vaginal discharge, which we mainly see in these 4 types. And then there's another type, a 5th type, which is actually not a white discharge at all. It's a white film-like substance that we see passing through the urine. This is usually part of a urinary infection where we can see this film-like, a mucus layer like this passing through. This is often in the urinary tract. As we know, the urethra is located right in the vaginal area. It's understood to be caused by an infection or pus in that area. So in such cases, we can treat it by using medicines that clear the urinary tract, or by using necessary washes, or by applying the appropriate medications. So I hope you have understood all about this topic. We'll see each other again in another episode. Thank you.